Hi, Denise Noyerez here. I'm a fertility acupuncturist with a wellness clinic, and I was having lunch with my friend Dr. Kari Hong, who's with Thousand Oaks Family Dentistry in Newbury Park, and she's amazing. And we were just talking about our businesses, and we started talking about preconception care, and she was letting me know how important it was for you to make sure you have your teeth cleaned while you're trying to get pregnant and while you're pregnant. So she's going to talk a little bit about that. Can you tell us a little bit about that?
Yeah, so there's a common misconception sometimes that when you're pregnant you wouldn't want anyone working in your mouth or treating your teeth, but actually it's probably one of the most important times to make sure you're receiving proper dental care. And there's a lot of research out there that shows that the bacteria that can reside in the mouth when someone has periodontal disease can actually result in early birth or low birth weight. So for that reason, we do recommend that when a woman is pregnant or trying to get pregnant, that she makes sure that her gum health is in its best possible condition. One of the things that happens when you're pregnant is due to all the pregnancy hormones, it can cause something called gingivitis, which is basically just that the gum tissue becomes red or inflamed and it can bleed, and that can also make you more prone to getting bacteria in the gum tissue that could then result in the low birth weight or preterm labor. So we do think it's really useful to do your regular general cleanings, and if you haven't been evaluated in a while, make sure that you have a proper evaluation to make sure that your gum health is good, and if it's not, to have it cleaned so that there is no bacteria being harbored in those areas. The other thing we like to talk about is before you get pregnant, it's good to do elective procedures. So if you have any tooth decay or anything, teeth that need to be removed, like wisdom teeth, that you manage that prior to the pregnancy, because when you are pregnant, we do recommend only doing elective procedures later. You would only do things when pregnant that are absolutely necessary. So if you had an infection or something, obviously you'd want to treat it, but if you had a cavity, the school of thought is to wait until after you give birth to actually do the filling, just because there's no reason to necessarily take an x-ray or do treatment if you don't have to, if you can wait. But obviously it's better if you did that prior to getting pregnant, so that when you are pregnant you don't have to worry about your dental health.
Right. Well, very good. And how often do you recommend somebody get their teeth cleaned and checked?
So assuming everything is good, meaning there is no active gum disease, every 6 months is the general recommendation. If there is gum disease, so it's very person specific, then it could be as often as every 3 months.
And then when you are pregnant, is it still just stay with
every
the
6 months?
It's still 6 months.
Just general cleanings. We just wouldn't take elective x-rays during that time. Well, it's still very safe and you can protect the mother and the fetus. It's still better to wait until after one gives birth or do it before.
Definitely. Great. Well, thank you. So if you haven't had your teeth cleaned in a long time, make sure you go to your dentist, and if you're trying to have a baby, make sure you go get checked. And we'll see you soon. Bye.